Hi, I'm a faculty member. My name is Robert Mashi. I'm a practicing physical therapist for more than 25 years now. I'm a board certified orthopedic specialist, and I teach a large part of the clinical orthopedics courses in the DPT program. I also mentor and work with students in our clinical practice sites, and I contribute to our orthopedic residency where I mentor and teach in the residency program. I'm also involved with the Running Performance and Research Center where I conduct research, and I also do video analysis of running mechanics to help injured runners. I've been part of the Drexel faculty for 9 years.
Hello, I'm Sarah Wenger. I'm one of the clinical faculty. I work at 11th Street, which is the pro bono clinic. I'm in charge of SPLs and I am in PPL with you guys. I teach the pathophysiology series and in the clinical reasoning series. I like playing soccer and I love food and cooking, and I'm looking forward to meeting all you guys.
Hi, my name is Kate Mitchell. I am a physical therapist. I've been a physical therapist for over 30 years. And in the program, I wear a couple of hats. The first role is that I am the Assistant Director of Clinical Education, so work alongside the ClinEd team of Dr. Megan Schaefer and Noel Goodstead to coordinate our clinical education program. And in addition to that, I am a neurologic clinical specialist and teach the adult rehab component of the curriculum, and also I'm passionate about and can contribute to the professionalism series in our curriculum.
Hello, and welcome to Drexel University. My name is Noel Goodstead. I'm an associate clinical professor in the Department of Physical Therapy and Rehabilitation Sciences. I wear several hats in the department. I'm the Director of Residency Education. I'm also the Director of the Human Gross Anatomy Lab. I get the pleasure to teach the DPT students through the first 9 months of their first year in Human Gross Anatomy 1, Human Gross Anatomy 2, and Orthopedics of the Upper Extremity. I also get the opportunity to work with the students in the clinic on main campus in the integrated clinical experience. I hope you all have a great day today, and I look forward to meeting some of you. Take care.
Welcome. My name is Dr. Lisa Ciarello, and I'm a professor and director of the Dr. Health Science Program in Rehabilitation Science. Although I am primarily involved in the PhD and Doctor of Health Science programs in Rehabilitation Science and conducting research in pediatric service delivery, I am passionate about and value my role in the DPT program. I participate in teaching the pediatric content in the curriculum. I advise students and enjoy mentoring them in the professional development.
My name is Dr. Maria Benedetto, or as my students call me affectionately, Dr. B. My areas of clinical specialty are pediatrics, all the way from birth to youth and adolescents. I treat our university dancers here, which is at Drexel in the undergraduate dance program in the clinic, and I teach the DPT students pediatric physical therapy, lifespan, motor learning and control, and clinical reasoning courses. I'm engaged in community activities for youth in underserved areas and populations for the city of Philadelphia. And I'm very proud and happy to say that I have our DPT students volunteer and help out in some of these wonderful programs that occur in Philadelphia.
Hello, my name is Claire Milner, and I'm an associate professor in the department. I'm also the director of the PhD program in Health and Rehabilitation Sciences, and I direct the GATE Lab. In the DPT program, I teach a class in the research sequence. I teach the class Research and Measurement in Physical Therapy. As a human movement scientist, I really enjoy this opportunity to interact with our DPT students and to talk about measurement and how to consider that as a part of interpreting the clinical research that will be a key part of your evidence-based practice in the future.
Hi, I am Dr. Ellison. I am a new assistant research professor. My primary focus is in knee arthritis and looking at how it interacts with comorbidities. Before becoming a researcher, I was working in an outpatient physical therapy clinic, and that's really where my passion kind of developed from, was managing a lot of the arthritic conditions in our older adult population and seeing how that can really prohibit and cause development or progression of comorbidities. I look forward to sharing some of my findings with you, exploring new research experiences and opportunities, and helping you become the best physical therapist that you can be. In the meantime, be well, be safe, be healthy, and hopefully we will see you soon. Take care.
Hi, my name is Sarah Tomaszewski, and I'm an assistant clinical professor in the department, as well as a board-certified orthopedic physical therapist. I teach clinical courses in the first year of the Doctor of Physical Therapy curriculum, as well as some content in our orthopedic residency program. I also have the pleasure of treating patients at our department-run clinical practices, where I'm able to mentor DPT students and also mentor orthopedic residents. My areas of interest in addition to orthopedic PT are chronic pain management and clinical reasoning.
Hi, I'm Margaret Finley. I'm a member of the research faculty here in physical therapy and rehab science. I'm a physical therapist for over 30 years, with my clinical background being orthopedic and sports medicine. In my research world, I look at the development and progression of musculoskeletal pain in people following a spinal cord injury. For the DPT program, I'll be teaching you evidence-based practice as well as applied biomechanics. And I look forward to potentially meeting you in person. Take care.
Hello, I'm Dr. Ben Bindermarki. I just started at Drexel as a PT faculty member in July. As I start my current role, I'll primarily be in a research capacity. I am both a PT and a biomedical engineer, and I combine these expertise to conduct translational research. Prior to joining the faculty at Drexel, I was at the Shirley Ryan Ability Lab, which is a rehabilitation hospital in Chicago, conducting research in their translational biologics lab. As I start here in Drexel, my research primarily focuses on muscle adaptations as a result of neural injury, such as a stroke, or disease, such as cancer, and the effects of these adaptations on function. I look forward to meeting you all.
My favorite part about the program is having you guys in the clinic at 11th Street, taking those of you who decide to go on the trip to Guatemala abroad. And I think the thing I like best about our department is the culture, and having a culture of collegiality where we're not just teaching you guys to be good physical therapists, but also teaching you to be our colleagues in the future and welcoming you into the profession, and really focusing on patient care and what kind of PT you're going to be, as opposed to what kind of accolades or what kind of grades you get, really focusing on who you're going to be when you're a professional and preparing you for that.
I would have to say those students who are willing to take chances, those who are willing to give an answer, even if they might be wrong. I'm looking for that in students in my class, because they're the ones who are going to learn from their mistakes now so that they don't make those mistakes in the future.
The Drexel DPT program has several unique features. One of these is the fact that we have clinical faculty who are actively practicing physical therapists. We also have research faculty who are engaged in research projects. And our DPT students are taught by both of these professors. So it brings a theoretical as well as a practical edge to the classroom. I'm a practicing physical therapist, and so I can bring current practice models into the classroom. So I may see a patient in the clinic on Monday, and then I can talk about that patient in class on Wednesday. I can talk about how the patient presented, what interventions I did, and what the outcomes were. So it really brings a cutting-edge clinical perspective to our students.
I'm a true believer in that who we are surrounded with today is a reflection of who we will be in the next few years. So I wanted to make sure I was in an environment in a community where I felt supported but challenged. And from the leadership team to the faculty, to the colleagues, staff, students, I do believe that everyone here is not only supportive, but will challenge you to be the best version of yourself, both professionally and personally. So welcome. Congratulations on choosing Drexel. Congratulations on choosing what I believe is the best profession in the world. Take care and be well, and see you soon.